What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome. If you've been here for a while, watched the video, maybe even liked and subscribed, I appreciate you and welcome back. So today I want to talk to you about something that's kind of got called out. They said, yo, Ty, we watched your videos and most of the time you're talking about the radical prostatectomy, but you say you considered active surveillance, but there's no video on how you went about that. And I was like, oh, well, you know what? That's right. I could do that. I was a little apprehensive about active surveillance, right? And the reason is because that means you're doing nothing. You have decided to do nothing. And for that reason, I want to preface this with I'm not a medical professional. If you are deciding or in the process of selecting active surveillance, you need to do so with your medical professional. What I want to do here is I want to make sure that you are in the position to have that conversation with your medical professional and kind of have an idea of how that should go back and forth and some questions that you could ask. In addition, I'm going to tell you how it is that I went about it so that you can make whatever decision is best for you and the outcomes that you're looking for. So, with that being said, let's get into active surveillance. So active surveillance is just that, gentlemen. It is the fact that you have been diagnosed with prostate cancer. And if you've been given this as an option, your doctor has determined that you have a low risk, low grade prostate cancer. And that your Gleason score is early or very low. 3 plus 3 equals 6. And in some cases, 3 plus 4 equals 7. Now, if they've determined that, then they may have told you that you have the option of doing active surveillance. Now, I was 3 plus 4 equals 7, and I was hoping that this option was going to work for me. Because the pro of this was no surgery, which meant that all of the outcomes that I was reading about were not necessarily immediately going to be something that I had to deal with. So, of course, I was paying attention. You mean to tell me y'all could just look at this? It's going to grow really slowly? And we're talking about at least 15 years here. So we're not even talking about a circumstance where this was going to be an immediate thing or even close. They were going to actively surveil it, and most of it is over 15 years. You can look at the research. So I was like, wow, this is something. No surgery is necessary. However, I need you to think about some other things, right? So the first thing that happened is that when you actively surveillance, you still have to go to the doctor. And that schedule for the doctor is consistent. You have to go get your PSA drawn like every 6 months or so. And they're checking to see whether or not there's been any changes. And so you have to go to the doctor for that. The active surveillance also includes the digital exam. Now, I don't know that they have to do it once a year, but that digital exam is going to still be applicable because you still have your prostate still in your body. So you need to also understand that. Now, the other thing that goes into this is that you're going to have biopsies. They're still going to have to go in and see whether or not you're going to have, or you're having like if your cancer's in there and if it's still at the same grade. So you're going to have a biopsy. Now, I'm not sure how often you're going to have that. Of course, you could do the research for that. I don't want to get too much into that. And then you also still have to have those MRIs. Now, the frequency of these types of things are different for everybody. But you are going to have all of those things because they need to see whether or not your prostate cancer is progressing. So you need to go through all of that. Now, when I thought about all of that, I was like, okay, so the pro is no surgery. The con is it's going to cost me a little bit of money. Over 15 years, potentially going to the doctor, $40 copays, the price for the MRI, I talked about that. In some cases, your insurance may not cover it. I said, that's a lot of money. I understood that the radical prostatectomy was surgery. It was going to be all of the money up front. But I was looking at it and I was like, you know what? These are small cuts. These are small cuts, but I'm still doing that. And the con of this, right? The bad part of that was I still had prostate cancer. It was still in my body. I still had it. And what I was basically doing was waiting for it to get worse so we could decide when we wanted to do something. That was tearing me apart. Of course, I didn't want any of the outcomes. But I was sitting there thinking, do I want to hold this in my body? Do I want to get to a point where this is getting worse? Because that's really where it's going. But that's not all that I did, right? When I looked at active surveillance, and again, this will work for some of you, because your cancer is low grade. Do not run to get a radical prostatectomy or to get radiation right away. It's not necessary if your cancer is growing very slowly. Now, a lot of people will say, well, prostate cancer grows slowly. That is not the case for everybody, right? In most cases, prostate cancer grows slowly. But for some individuals, when they find out that they have prostate cancer, they're in a different circumstance than you are in. And why is that? What was the problem with me and what I had with active surveillance? So I'm going to give you the real. Here is the thing. When they do active surveillance, what I didn't know was two things. One, when they were going to go forward with doing something. At what point? How bad did it have to be? Could I just decide that I wanted to go forward with surgery, because I'm like, look, I can't take it anymore. I still have prostate cancer. It's driving me insane. The other part was, where is my prostate cancer located? Right? So when I looked at all of having the conversations, I was like, look, it might be a really small spot. But where is it? Is it in a place that it could grow outside of the margins and metastasize and end up somewhere else? Again, it doesn't have to be huge, but it could actually start growing outside of the prostate. And that is what pushed me to making a different decision. The reason that it pushed me to make a different decision is because it was important to me that I did something while the cancer was contained in my prostate. And I couldn't take the chance of waiting for it to grow outside and catching it too late. You think about every 6 months or whatever the biopsy was, let's say you do it once a year or whatever. By the time you go from year to year, you might find that thing is doubled in size and now it's growing somewhere else. And that's a whole different set of problems, gentlemen. I'm not saying that it's going to happen fast. Some of you don't write in the comments, it doesn't happen that fast. That's not what I'm saying. What I'm saying is that it is possible for that to happen. And even if you are 3 + 3 = 6, you could find yourself in a worse circumstance. So I decided I wasn't going to do that. So that's why I decided for the radical prostatectomy. The active surveillance, I thought the cost was not going to be what I wanted it to be. And also, while actively surveillancing having prostate cancer in my body, that was a problem for me. Now, there's another type of active surveillance that also occurs. You don't get away from it if you decide that you want to do some other option. If you decide to have the radical prostatectomy or if you decide to have radiation, you are still going to be actively in a surveillance situation. That is post-treatment. You are still going to go get your PSA drawn every 6 months for the radical prostatectomy to make sure your PSA is less than 1. And of course, if you had the radiation or some things, they want to make sure that it's not going up. And so, you're still under active surveillance. You don't escape it because you make some other decision. It's just a different circumstance. If you look at one of the videos about the anxiety that I have every time I have to go get my PSA drawn every 6 months. And it was every 3 months. It's now progressed to every 6 months. So I'm letting you all know, you're not going to escape the active surveillance. The difference is, Under one set, you have a low-grade, low-risk prostate cancer that's growing very slowly and they're actively surveillancing it. The other side, you've already had whatever it is treatment option that you were going with. You're dealing with the outcomes, and then you are still getting actively surveillance to make sure that you haven't gone any further. The difference is that in one case, you still have your prostate cancer in your body, and hopefully on the other side, you don't have the prostate in your body anymore. It was within the margins. They got it all out. And now your negative outcome is whatever it is, or whatever outcomes are coming with whatever treatment option you've come with. Now, gentlemen, I'm not here to tell you which one to do. If you're like me, you are deciding, if you just got diagnosed with prostate cancer, you're trying to decide between radiation and active surveillance. That is exactly, you're like, look, I don't want that surgery. I neither. And I'm not telling you that it's an easy decision to make. And I'm not telling you which way to go. I'm just telling you that I believe that for some of you, active surveillance is absolutely the way to go. Don't go running to get that surgery, to get that radiation. It's not necessary. For others, you better consider where you are and what it is that you want to do. You're younger like me, maybe better to go ahead and get that thing out. Again, talk to your doctor. That was my decision. I was young. I'm going to go ahead and get it out the way. But for some of you, that you're not in a place for that. So, as you consider this whole thing holistically, just make sure you do pros and cons of all of them for the immediacy of what it is that you'd like to see and long term. You cannot be short-sighted here, fellas. You can't say active surveillance works for me today, and then your prostate cancer is worse off 10 years from now, and now you're wishing that you had got it out earlier, because again, it's not how that works. You can't go back to the beginning and say, oh man, I want that. Oh, I want the other option. Likewise, you get your prostate out right now, you're going to have those outcomes for 10 years, potentially some worse than others. Maybe, by then it's progressing. Some people roll the dice and say that they're going to hope that technology has progressed enough that when they have to get theirs out, it's great. I agree with you wholeheartedly if that's the decision that you make. Again, I'm not here to sway you one way or another, just putting you in a position to have the conversation with your doctor. What's the short term? What is the long term? How do the outcomes play out long term?